Julia Yellow for The Washington Post. Julia Yellow for The Washington Post. For babies, the benefits of breastfeeding are clear: a stronger immune system, reduced risk for some chronic health conditions, and a closer bond with mom. But does breastfeeding also protect women against breast cancer? Nursing has been linked to a reduced risk of breast cancer risk in both pre- and postmenopausal women. But, says Virginia Borges, director of the University of Colorado Cancer Center's Young Women's Breast Cancer Program, it gets complicated from here. Nursing a baby changes the structure of the breast. Even after breastfeeding ends, microscopic changes in the milk delivery system protect the breast against precancerous cells, Borges says. This effect is more common among women who have nursed more children, or for longer periods than others. The older a woman is when she gives birth for the first time, the more likely she is to get breast cancer. But, Borges says, it's not that simple. I would never want a woman to decide to not have a child because of anything related to breast cancer. Breastfeeding may moderately offset the increased risk of breast cancer associated with pregnancy. Research has shown that women who breastfeed can cut their risk of some aggressive breast cancers by up to 20% relative to women who don't nurse. One group of women, though, doesn't seem to experience the same effects: African Americans. Although white women experience breast cancer more often after menopause than African American women do, young African American women are more likely than white women to face aggressive, early onset forms of breast cancer. Black women also breastfeed less often. According to the Centers for Disease Control and Prevention, substantially fewer African American babies than white babies are breastfed. Breastfeeding a baby has been found to be protective against both short-term and longer-term health issues for mother and child. Black women are more likely than others to face lack of support for breastfeeding at work, may lack community support, and may have cultural attitudes that influence them not to nurse. Hospitals play a role, too. In 2014, the CDC reported that hospitals with a larger population of African American patients were less likely than others to promote breastfeeding. So should you plan on nursing to potentially stave off breast cancer? Absolutely, Borges says, but it takes two to tango. Not every woman or baby can successfully nurse, and breastfeeding may not be an option because of cultural, lifestyle, and other factors. If a woman isn't able to breastfeed, or chooses not to, lifestyle choices could help stave off breast cancer even without the protective effect of nursing. Things such as moderating or eliminating alcohol and exercising are strongly linked to protection against premenopausal breast cancers. And, Borges says, there's no reason to think they can't help protect against breast cancers in younger women too. Learn more: cdc.gov. Conserve breast.